group of international researchers from Makerere University and Malago Hospital in Uganda, and from University of Notre Dame and Harvard University in the United States collaborated to explore the hidden costs of healthcare during electricity failure. Surgery risks increase when electricity is accessible but unreliable. During unreliable electricity events and without data on increased risk to patients, medical professionals base their decisions on anecdotal experience. Decisions should be made based on a cost-benefit analysis, but no methodology exists to quantify these risks, the associated hidden costs, nor risk charts to even compare alternatives. Two methodologies were created to quantify these hidden costs. In the first methodology, through research literature and/or measurements, the authors obtained and analyzed a year's worth of hour-by-hour energy failures for 4 energy healthcare systems, EHS types, and in 4 regions: solar PV in Iraq, hydroelectric in Ghana, solar PV and wind in Bangladesh, and grid and diesel in Uganda. In the second methodology, additional patient risks were calculated according to time and duration of electricity failure and medical procedure impact type. Combining these methodologies, the cost from the value of statistical lives lost divided by energy shortage is calculated for EHS type and regions specifically. The authors defined hidden costs due to electricity failure as VSLE and compared this to traditional electricity costs, including levelized cost of electricity. This is quantified into a fundamentally new energy healthcare system risk chart based on severity of event, which is the probability of deaths, and likelihood of event, the probability of electricity failure. VSLE costs were found to be 10 to 10,000 times traditional electricity costs. The single power source EHS types have higher risks than hybridized EHS types, especially as power loads increase over time. But all EHS types have additional risks to patients due to electricity failure, somewhere between 3 to 105 deaths per 1,000 patients. These electricity failure risks and hidden healthcare costs can now be calculated and charted to make medical decisions based on a risk chart instead of anecdotal experience. This risk chart connects public health and electricity failure using this adaptable, scalable, and verifiable model.